The first thing to realise is that this can happen out of the blue, and typically is associated with people who are diabetics, middle-aged to late-aged people who are diabetics. So there's a 5-fold increase in diabetics. How to make the diagnosis? Well, typically the pain is present at rest and at night, and the pain is present in all directions, in all planes of movement. So you're talking about global, painful loss of motion. The classic feature is loss of external rotation, and if your patient has painful loss of external rotation, then they either have a frozen shoulder or glenohumeral arthritis to all intents and purposes. The diagnosis is made based on history and examination. Imaging is purely for confirmation or exclusion of other pathology. And you may see features on MRI scan to confirm the diagnosis. The key thing is to remember that the injections, if they're done, need to be into the glenohumeral joint, so into the shoulder joint, not into the subacromial space. And probably 6 weeks apart would be a reasonable starting point, combined with gentle stretching exercises. And a lot of this has to do with patient education, so the patient needs to understand the natural history of this condition, which is initial freezing period, which will be painful and stiff, then a frozen period which will be not painful but still stiff, and then a thawing period which will be gradual resolution. And typically the figure bandied about is 18 months for this whole thing to resolve. Sometimes the condition is resilient or not amenable to non-operative treatment, in which case a simple manipulation and anaesthetic and arthroscopy may be in order. But the majority of cases will settle without surgery, just as long as the patient is well educated and learns to manage their symptoms.